Okay, here is my CPAP presentation for my methods of teaching class. CPAP stands for continuous positive airway pressure. Then in the picture there is a picture of some EMS workers in the back of an ambulance, and they are giving their patient CPAP. What is CPAP? CPAP is a non-invasive means of providing ventilatory support to patients. CPAP is a face mask that goes over the patient's nose and mouth and is held to the head by a strapping device. CPAP delivers the same amount of air pressure to your patient constantly. So then if we go back, there's the picture of, and you can see the strapping device kind of like above his ears and then around his mouth there, and then the face mask over his nose and mouth. CPAP is also becoming a lot more used at the EMT basic level because of how easy it is to use, but still not all EMTs are trained to use it. EMT basics, are trained to use it. Okay, so now the history of CPAP. The original CPAP machine was invented in 1981 by Australian Dr. Colin Sullivan and his associates. They basically reversed the idea of the vacuum cleaner motor. Instead of bringing things in, the CPAP would help to push things out, which then applied positive air pressure into the upper airway, which would push a constant flow of air into the lungs. And then at the end of the 1980s, they had started to improve it, and so they improved the masks, and the machines were quieter, and also the Dr. Sullivan's research paper had been approved. So now let's talk about the purpose. So the purpose of CPAP is to improve ventilation and oxygenation and avoid intubating your patient. So here's a few important key terms that I feel that we should review just because they go along with this whole CPAP presentation, and they're just very important. So respiration is the exchange of gases between a living organism and its environment. Ventilation is the supply of air to the lungs by artificial means. And then oxygenation is the process of delivering oxygen to the blood by diffusion from the alveoli following inhalation into the lungs. Okay, and then here's two other ones that I feel are really important. Minute volume, so that's the amount of air that moves in and out of the lungs per minute minus the dead space. And then tidal volume is the amount of air in milliliters that is moved in or out of the lungs during one breath. So now let's talk about what CPAP does for your patient. So CPAP increases the pressure in the lungs, opens the collapsed alveoli, and the alveoli are those little grape-like bunches in the picture, which then pushes more oxygen across the alveolar membrane and forces the interstitial fluid back into pulmonary circulation. So now let's talk about a few of the patients that would receive CPAP. And most of these patients are going to be your load and go patients. So for the first one would be management of CHF, so congestive heart failure, secondary to pulmonary hypertension. Another one would be your chronic obstructive pulmonary disease patients, your COPDers. Then you're also going to have your acute pulmonary edema, your respiratory distress, your toxic inhalation, like toxic gas, like chlorine, smoke, things like that, and your near drowning patients. A lot of times, many of these patients are going to receive advanced airway devices, but research has shown morbidity and mortality when these types of patients receive intubation for their condition in the field. CPAP has shown great results with a lot of these patients, but it does not always help. And then also, you also see CPAP used for obstructive sleep apnea, where they wear this CPAP unit at night, and it helps to maintain their airway. Okay, so what type of people are going to receive CPAP? So patients that were going to receive CPAP, they must be alert and able to follow your simple commands. So if you say to them, like, are you doing okay? Shake your head yes or no. They must be able to do that. Their pulse oximetry reading is usually less than 90%. Patients, they're showing signs of moderate to severe respiratory distress. So meaning they're in the tripod position, or they're using their accessory muscles to breathe. And then also if the patient is breathing rapidly so that it affects the minute volume. So like CPAP, it treats the symptoms, and it's not a permanent fix for what is going on. So it's important to get these people to the hospital, but this is a great way to help them. So what types of patients do we not give CPAP to? Patients that are unable to follow verbal commands, active vomiting patients, or GI bleeding. So active vomiting, we're obviously not going to give it to those patients because we need to protect their airway. And how can we protect their airway if they have this mask on? And then a patient who also has a trach, signs and symptoms of a pneumothorax or chest trauma, or a patient who is in respiratory arrest, and then facial trauma. Obviously, we're not going to give it to somebody with facial trauma because how do we secure it to their face? Because that face mask seal, that tight one, is really, really important. Okay, so this is really, really important. Obviously, it's in bold. At any time when your patient no longer can follow simple verbal commands, you should remove the CPAP and provide ventilation by a BVM device attached to high flow O2, and then consider intubating. Very, very important. So then some of the goals of CPAP, which go back to the purpose, would be to decrease the workload of breathing, to increase the amount of inspired air, and then it has also been proven to shorten the length of time the patient is in the hospital, meaning when you intubate somebody, then they are usually there for longer because then they have to be extubated and all that stuff. Whereas the CPAP, all you do is just take it off their face. Okay, so this I felt was pretty important to talk about because when I was on clinicals in the hospital, I would always hear them say CPAP, and then I would always hear them talk about BiPAP, and I didn't understand the difference, so I think it's important to know the difference. So BiPAP, it stands for bilevel positive airway pressure, so it's basically like a CPAP machine, but BiPAP has two different air pressure settings, so that means BiPAP exerts high pressure when the patients inhale and then a lower pressure when patients exhale. So this differs from CPAP because CPAP, you are constantly getting that continuous positive airway pressure. Okay, and then next, before we talk about putting it on your patient, the CPAP machine, and applying it in the steps, we're going to talk about coaching your patient. You need to be their coach. You need to explain to them the process and how it might feel uncomfortable. You could see them become claustrophobic. They might not want to do it, but you need to basically persuade them that it's going to benefit them. It's not easy to do. Like I said, you'll have to convince them to put it on. There's also the possibility of a pneumothorax. This is really small chance, but if you continue to monitor your patient, you should be fine. Okay, and then that will be the next part. But